Hi guys, Nurse Nikki here at City Facial Plastics. We're going to be reacting to the 5-minute nose job, the non-surgical rhinoplasty by Viva Skin Clinics.
Hi guys, welcome back to the Viva Skin Clinics YouTube channel. So a lot of people forget that it's not just your selfie profile angle when it comes to a nose, and it's not your straight on. The improvement needs to be made at a full 180 degrees worth of angle. So if I can get the nose better at 180 degrees of that entire view, you've got a really good result.
So noses are very fun to inject, but they are also very high risk and dangerous. With this kind of strict standard and improvement that he's going for at a full 180 degree angle improvement, I personally would recommend surgical rhinoplasty. Over the past, I've never offered liquid rhinoplasty to my patients, but over the years, I've become more educated, experienced, and confident to provide it. But with that being said, I do have a lot of limitations with this procedure. I only work on camouflaging the little lumps on the bridge of the nose to improve the profile. I don't get creative in this area, and I don't treat the tip of the nose. And this is because even with something like aspiration, it's never 100%. And there's just so many arteries in the area, and we can never, ever be too safe. So I don't go down the sides of the nose because that's where all the arteries lie. I don't do things like a Tinkerbell lift. And for those of you who smile and the nose kind of droops down a little bit, I just pop a little bit of Botox underneath the nose, and that will alleviate that muscle.
About what bothers you about your nose?
So I've never really had a problem straight on, but I always see my nose from the side and I don't like my bump. And even though other people don't notice, I always pick it out. So I think it's going to really boost my confidence, just straightening it out.
And where do you notice it most?
Really, when I look in photos or when people take photos of me. So that's why I don't really like taking photos too much. And when I do my makeup in the morning, I don't like turning my head to the side.
Oh, so it is having an impact on how you feel in photos.
Yeah, and I've been thinking about this for a very long time. So
how long roughly?
Maybe 2.5 years.
So the average time it takes for someone to think about doing something and coming into the clinic and sitting where you are is 2 years. It's interesting, isn't it?
Yeah, I feel like fillers and plastic surgery always has a negative image, family members, friends, or online. But when you think about it, I'm doing it for myself, I'm not doing it for other people.
For that reason, you're the best candidate for this.
So I think Dr. Rupert is correct. If you're going to do anything like a medical procedure, even if it's something very minimal like Botox, you should really want it for yourself. I think a lot of us kind of fall into this whole thing where we're comparing ourselves to photos online. Really, even some aesthetic profiles, they're all Photoshop. So please do not compare yourself to filters and photos that you see online. It's really important to want it for yourself. Also, I think it's important to talk about candidates that are not ideal for this procedure. One being patients with a very large dorsal hump. And that is because if we try to camouflage a very large lump in the nose, it's going to look too wide and it's going to look too big. The radix point that we inject at is going to be way too high, so it's not going to look natural on the face. The other thing are patients who have prior surgical rhinoplasty. Those patients who have prior surgical rhinoplasty, they're going to have altered vascular structure within the nose, so we cannot tell where those arteries lie. And then the erratic vessels, they actually may run very deep. So even staying on bone, you're at a really high risk doing this procedure. I think it's super important to be honest with your providers. I have had patients come in and they omit things from their medical history and their prior surgical history. So I have them in the chair, I'm going to mark them, and then I see a little surgical scar, and then they tell me about the surgery. So it's really important that I know this prior and your injector knows this prior, because it would really be a disservice to continue with the treatment, and it might actually put you in a lot of harm's way. So just keep that in mind. It's really my personal preference as an injector. I just don't want to expose my patients to that high level of risk. And I think that fillers should be used really for slight enhancements for the face.
Because it should be about how you feel. It's not about external pressures. So if it improves your confidence within, then you're a good candidate for this. If I look at you from the side on angle, I see that you have a little bit of dominance to this side of the nose, so the bump there, the nasal bridge. So to make that appear smaller and a little bit straighter, it's how the light hits the nose. So noses are all about optics. So at the moment the light's hitting the nose with a wider surface area on the bump, so it's looking like it's bigger. If I put some product above and just below to soften this indent, what happens is the light's hitting the nose at almost less of a surface area and a straight line, which means that it appears straighter. So most of the time noses are not as straight as they should be because of the way the light hits them. So my first injection point is going to be just above the bump, and what that's going to do is it's going to make the little indent look straighter. So it's not going to mean the nose looks wider, it's just going to slightly elevate the area above the nasal bridge, which will mean that at this angle it's straighter and all the way around as well. In terms of symmetry, what I'm seeing is this little indent here, just above, just below the bump.
I agree with Dr. Rupert's first injection point above the bump of the nose. Her radix point is not too high. You can see it here, so it'll give a really natural result and slope. But the injection point maybe on the side of the nose where she's a little bit more prominent, we can really run into problems there because that's where all the vessels lie. Just keep that in mind.
So by putting some product here, it will soften the appearance of this little kink, so it will look straighter. I'm just going to put some anaesthetic cream on, which will numb the nose. So I just do a little drop here and a little drop here.
So it looks like he's going to use Juvederm Voluma, and that's a high G prime filler. I personally like Restylane Lift for the nose. It really stays where it's supposed to be. I feel that over the years I've seen that Juvederm products tend to spread more, and we don't want this to make the nose look wider or bigger. So I think Restylane Lift is really the greatest product for this area. And a little bit why G prime matters. So elasticity is measured by the G prime. So dermal fillers with a high G prime such as Voluma or Restylane Lift, they tend to be firmer, they tend to keep their shape and stay where they're put, and they have a lot of lifting capacity. So we use them in areas like the cheeks, the jawline, the chin, anywhere where you need that really strong structural support for the face. Dermal fillers with low G prime, such as Restylane Kiss, they tend to be thinner, more fluid, they have easier spread, so they're used for areas of the face like the lips. So it does matter what product you're using for the part of the face.
So now for a little pinch.
So he's using a little bit of an aspiration technique. You can see in the video, if you look closely, the needle is moving ever so slightly. So even with aspiration, there's no way to tell if you're in a vessel. So there's no way to tell if we're safe. I personally, when I'm injecting, I start at the radix point and I do something called the pinch and lift technique. And I learned this at a cadaver class that I took. I'm pinching the nose where I'm going to inject and I'm compressing the arteries on the side. And it allows me to be further away from that middle radix artery. So it's really important that I keep my hands anchored while I inject. It allows me to keep the filler in a narrow position at the injection point so that the nose does not look too wide. I like that he's using a needle technique. There are several studies where people have been using cannulas and that actually puts you at more risk and it's more dangerous because if you think about it, when you go inside of the nose, say if we're starting here at the tip and we feed that above a large dorsal hump, there's no way to keep that cannula down on periosteum. And if somebody is going to inject you, it's best to ask them what their technique is before they start.
This might feel a little bit more scratchy. For a little pinch. Well done.
Okay, so again, he did go on the side of the nose. Those are where all the vessels lie. And he's at a 25-degree angle, so I don't think he would be down on bone there. What I don't do the aspiration technique because, again, the needle is moving ever so slightly, so we can't rely on that for safety. What I like to do is keep it down on bone, inject very, very slowly, tiny micro droplets, and in the process, I'm observing the skin for any blanching. I'm asking the patient how they feel. They should not be in any pain. And then coaching them through little breathing exercises. It really helps the process go by.
Beautiful! That looks super.
It honestly didn't hurt at all. I was really shocked.
So we have the moment of truth for Sophia now. So super excited to give her the mirror. Are you ready?
Yes. Oh my god. That looks so cool. My bump's kind of smoothened out a bit and my nose looks way straighter from the front as well.
And as you can see, downtime, literally zero.
Yeah. I just wanted my bump to go down a little bit and I've definitely noticed a difference. Honestly, I think it's supernatural. I don't know if anyone really noticed it.
I think for this type of result, it looks great. I'm happy she's happy without any complications, but she's shying away from surgery. But, you know, there are so many facial plastic surgeons out there that pride themselves on really natural results. There's no more noses you really see with that kind of 90s Hollywood look. They take ethnicity into account, all your natural features, and they keep it natural. So I think in her case, if she's been thinking about it for 2 years and it's a slight result, I would personally just recommend surgical rhinoplasty.
Why? I really like it.
That's what we want them to say.
Yeah.
Sure.
I can see such a big difference from the front and I didn't know. I didn't think I was going to see the most difference from the front as well. I think the biggest reason I put off for so long, because I was like, oh my god, it would be so painful, it's going to take so long. But I felt pretty much absolutely nothing. If you're a girl that gets eyebrows threaded, honestly, 100% worse. And I wish I did this sooner now. Oh my god.
I think it looks great. I'm happy that she's happy. I think it's important for us as injectors, especially with a high-risk area like the nose. It's important to not only be honest about the risks and the benefits, but also your area of expertise. You know, I recommend not doing this procedure if you're not comfortable doing so because it can cause blindness. And if you're not as experienced with other high-risk areas of the face, I don't recommend starting out with this procedure. If you do want to gain experience and you want to provide this in the future for your patients, I recommend a couple cadaver labs and then annual training with somebody who's qualified in facial anatomy. For patients, as always, research and choose the appropriate provider because it can be a very dangerous procedure, but it can be done safely in the right hands. I hope you guys enjoyed this reaction. Don't forget to like, comment, and subscribe, and I will see you next time.